For the treatment plan, the benefit is it's a roadmap or calendar of what treatment will occur, specifically what types of treatment.
So in our case, the treatment plan, when they presented it to us, the doctors came in and sat down and went over the schedule.
You want to know what kind of treatment your child is getting, and you want to know exactly anything that he's getting put in his body.
The NCI has sponsored and develops treatment summaries for all the different types of cancers that occur in adults, as well as those that occur in pediatrics. And you can download these resources that contain up-to-date information.
I think it's important to learn everything you can about the cancer that your child has, and more importantly about the treatment that your child is receiving for the cancer that they have.
I think that it's important to get a good feel for the overall treatment plan, but I don't think that parents benefit from doing a lot of forward looking, like, okay, if this, then that. Because the day-to-day is unknown, the week-to-week is unknown.
I stopped looking for what ifs, what hows, and all kinds of the nitty-gritty, and stuck with what's happening to her, what is it doing for her, what are the side effects that it's causing.
You still are in control. You can still say, all right, everybody stop for a minute, I want more of an explanation, or I want to talk to someone else, or, I'm going to make a decision for my child at this point.
It was very important to me not to question so much the protocol that she was on, but to gain information about what was happening to her.
Parents absolutely are a partner in this. They need to understand why you're doing something, why you're doing it in a specific way.
We want them to ask questions. We would rather them ask questions and speak up and not be intimidated by the white coats and the doctors and the degrees. We want them to be present, and we want them to be part of their child's care.
For every patient when they're newly diagnosed, my recommendation or advice to the family is, if a clinical trial didn't come up in the discussion, that the family should ask the doctor, is there a clinical trial available that my child could participate in?
In the beginning, the biggest decision that we had to make was whether to go on study or not. I remember it was in a conference room with about 15 professionals, her father and I, and we were offered two different ways that we could treat her leukemia. One was the current standard of care. Another one was a clinical trial. And they explained the clinical trial and explained how it was different than the standard of care. And we had to make that decision. We felt it was very, very important for us to do the study, to do the clinical trial, because the treatment for leukemia had advanced so much in the 20 years prior to Mackenzie being diagnosed. And if the moms and dads before us hadn't done those clinical trials, we wouldn't be being given the odds that we were given. She was given about a 90% chance of survival. And what they were trying to do which is very good, what they were trying to do was see if they could capture those other 10%. And so this clinical trial that we were offered was they were trying to see if they could capture and increase 90 to 100. And we felt that it was our obligation because it was other parents who had gotten us to that 90.
Your child is not being experimented on. People hear clinical trial and they automatically think, oh, my child's going to be experimented on, they're going to be a guinea pig, or a lot of people think they might get the placebo, or they might not get an appropriate treatment. And those are complete false statements.
I think that when people hear clinical trial, it becomes very scary. But by the time it gets to the children, it has been tested. We have to try these things in order to increase survival. We have to. It's absolutely not making your child a guinea pig. It is a chance to improve.
I think one of the key factors for them to realize is they don't have to participate in the trial. If they don't participate in the trial, this is how we will treat you. So they know it's their decision. If they have a reason they feel that this would not be in their child's best interest, they can come off the trial at any point.
The successes that we have today in treating children with cancer have come from the parents that have come before that have had their children on clinical trials, where we've been able to compare year over year, decade over decade, the treatments that we have with newer and potentially better treatments. And so the gains that we have, the outcomes that we have now, are based on those previous studies.
It's very important for you to understand the medications. It's also very important for you to understand the side effects of those medications.
So you have the list of drugs that the child will get. Well, it's very important that the parent has a list of all the toxicities to expect from those drugs and when to expect that your child may not be feeling very well, when to expect your child may be sick.
Adrian has had side effects in the past. You want to know exactly anything that he's getting put in his body. I think that's very important.
Knowing some of those side effects in advance helped us prepare to go, okay, he's going to need something to counteract this type of side effect. And it's a tweaking process, and you have to be prepared for that as well. So, just because he was prescribed this nausea medication, 1 or 2 of them didn't work. So we had to try different nausea medications.
So that's why it's so important that they're familiar with the toxicities from the therapy, when to expect those toxicities, and if they have any question about them, they need to call, because obviously the doctor or the nurse can't be with the patient 24/7.
It's scary, I'll admit, looking those things up and seeing what things they can cause, and knowing it's necessary to put that into your child. But I think it's important to understand what these drugs do and how to counteract the side effects to make your child as comfortable as possible. That was our goal, was to just get him through this as comfortably as we could.
I would definitely say to just pay attention to every little complaint that the child may say. I know there's going to be times where you're very tired and exhausted from trying to keep up with all the other stuff you got going on. But if they're saying, oh, my tummy hurts, don't brush it off as, oh, you probably ate something bad or something like that. Just to try and be in as tune as possible to what they're telling you, because what they're telling you may be something very important.
I think that the relationships that you establish with the people who are caring for your child, it shocked me. I giggle because it shocked me how dependent I became on them, how close I became to them, and how much I ended up loving some of them. These people see you at your very, very worst. They see you tired, they see you scared, they see you dirty. They see you at your very, very worst, and they love you because you're a human being.
You see them at their worst, but you treat them like they're at their best. You don't take it personally. We know that people are overwhelmed. We know that they're sad. We know that they're mad. And we take it all because we know that that's the way their reactions are going to be. We expect it.
You're going to be seeing them every day. They know exactly step by step what treatment your son is going to get through the long haul. And the more you talk to them, I feel like you're going to get more of an insight of what's happening.
Mackenzie relapsed, and Mackenzie has had the same team for 12 years. And so some of those people have helped me raise my daughter. But in the beginning, when you're just starting and you're just forming the relationships, they are your lifeline.
There's, of course, physicians and nurses and nurse practitioners, but also social workers and child life specialists, and there's radiologists, and you get to know everybody in the sphere of your child's care. You get to know the lab person that's good at doing pokes on kids. You get to know the radiation tech that works to get your child checked in for their scans. So it's a great big group of people that are focused on getting you and your child through this.
Nowadays, the treatment for cancer, most of it is done in the outpatient setting. So a child may come to the clinic, get their chemo, and then they go home.
I think that being home and having to walk your child through this at home is actually a really big bonus. It's a plus compared to how it previously was when the kids were in the hospital for long lengths of time.
Most of the journey takes place at home. And I felt that I needed to become an expert on giving her her medications.
Incorporating it into your lifestyle, because it's going to be a part of your life. Paying attention to the child, because at any given moment you may need to make that quick trip to, the care facility.
At home, it was more sanitary, really, preparation, because he's very compromised immune system. So we had to make sure that we kept everything as clean as we could for him.
I do think families grow into their caregiver role. I think that in the beginning, they can't imagine even watching their child get their porta-calf accessed, let alone sitting with the child on their lap and providing comfort while their child gets their porta-calf accessed. So I think that families over time, as their treatment progresses, they do become more comfortable with the types of things that are necessary to get their child through it, how to give a pill, how to encourage their child to take a pill, how to help their child take it when their child's not wanting to take it. In the beginning, they would just say, "Oh, my kiddo doesn't take pills," and then lo and behold, a little way into it, they go, "Oh, they learned that they can take pills, and they take pills like a champ because they taught them how to do it." And so there's a lot of progression of parents and even the kids through the treatment. It's not something that any of them probably ever wanted or wished to go through, but they do grow and learn as time goes on.
In my home, there were certain things that I had to have command of. And so I made sure that I knew those things.
Parents who thought they could never do certain things, like give their child a shot, give them certain medication, they rise to the occasion. And they develop confidence once they do it.
Oh my goodness. I think any parent who goes through chemotherapy is going to be like an expert nurse.